U.S. health officials are bracing for another wave of COVID-19 infections linked to the new Omicron variant. Case numbers here in the U.S. have now doubled every 2 days. This comes as the Delta variant continues to hit many states hard. The Fox Medical team's Beth Galvin here to talk more about this. And Beth, good to see you. There are a lot of questions about the vaccines and whether it will help against the Omicron variant. What do you know?
And Christine, the information's still coming in, but it looks like, breakthrough infections are going to be more common with this Omicron variant. So having that first, couple of doses of the Moderna or the Pfizer vaccine or the one dose of the Johnson & Johnson vaccine may not be enough to protect you. And that is why U.S. health officials are really pushing boosters, especially for seniors. White House officials say in the last 2 weeks, about 26 million Americans have received a COVID-19 shot, 14 million of them boosters. As scientists race to learn more about the Omicron variant, the CDC says has now been detected in at least 36 U.S. states and 75 countries. Dr. Anthony Fauci says early data appears to show that booster shots offer substantial protection against the new variant.
Our booster vaccine regimens work against Omicron. At this point, there is no need for a variant-specific booster. And so the message remains clear. If you are unvaccinated, get vaccinated, and particularly in the arena of Omicron, if you are fully vaccinated, get your booster shot.
The CDC projects that the Omicron variant now makes up about 3% of all U.S. cases and about 13% of new infections in some states like New York and New Jersey.
It means that it is vital for everyone to get vaccinated and boosted if they are eligible. Given the increase in transmissibility, this also means continuing to be vigilant about masking in public indoor settings in areas of substantial or high community transmission. And as of now, this represents about 90% of all counties in the United States.
And CDC Director Dr. Rochelle Walensky says the shots and masking are especially critical for seniors, pregnant women, and those who are immunocompromised.
If you are unvaccinated, you are very vulnerable, not only to the existing Delta surge that we are experiencing, but also to Omicron. And when you hear about Omicron being less severe or not, and you hear about those other things, it doesn't matter. If you are unvaccinated, you need to get vaccinated to diminish your vulnerability. And if you are vaccinated, to get boosted.
At the rate Omicron is spreading, the new variant could overtake the Delta variant in the U.S. as soon as next month. But White House officials say businesses and schools will not have to shut down, even if the U.S. experiences another surge in infections.
We have the tools to fight this virus, including Omicron, and we're in a very different and stronger place than we were a year ago, and there's no need to lock down.
If we didn't have these tools, I would be telling you to really, really be worried. But we have tools. So get vaccinated, get boosted.
And almost all North Georgia counties have higher substantial levels of the virus circulating right now, according to the CDC. So you may want to mask up when you go to the grocery store or you're around other people in public. And that is even if you are fully vaccinated and boosted, but especially if you are not vaccinated.